Hi, my name is Chris Centeno. I'm the Medical Director of Regenerative Sciences and here to talk to you about knee meniscus tears. Just looking at some simple knee anatomy, you can see the different parts of the knee, the femur or the thigh bone, the chondral cartilage on that, the tibia and the cartilage on that bone, and then the meniscus drawn here as these small little triangles. So again, the meniscus there, the chondral cartilage there. Going to again put all that together, draw in the meniscus as these small little triangles. And the meniscus is actually living tissue that acts as a shock absorber. A lot of people really don't understand that it is living tissue. And as living tissue, we have to preserve it as much as we possibly can. As we get older, injuries happen, the cartilage in the knee begins to wear out. And things sort of change. The amount of cartilage on the end of the bones decreases and the size of the meniscus gets smaller. Since the cartilage is the shock absorber, this means more wear and tear on the bones and pain as things start to wear out. Another thing that can happen is that somewhere along the way and all that, the meniscus can tear either due to daily use or trauma. So I've drawn in a tear there on the right. Now, if we switch from our schematic view to a top-down, more realistic view, you can see that that tear there would be represented by that tear there. So again, we're just switching from a more schematic view to a top-down, realistic view, and you can see how that one tear there would be equal to the tear that I've drawn in on the right. If we look at some major types of meniscus tears on this other type of model, we've got a transverse vertical tear that would look something like that. We've got a bucket handle tear that would look something like that. We've got a flap tear that would look something like this. So you can see there's lots of different types of meniscus tears. Anterior, posterior. And meniscus tears would be named by where they live. So if it's a posterior meniscus tear on the inside, it would be a posterior medial meniscus tear. In trying to repair these tears, blood supply becomes a very big deal. And I'm going to draw in the blood supply in red here. You can see the parts of the meniscus there that are in fact, or do in fact have a good blood supply. As you can see, it's really only the outside of the meniscus. So the tear there on the right that goes through the blood supply would only have a portion of that tear on the outside that would heal well. Now that creates a little bit of a problem because it means that if you have a meniscus tear on the inside, it's probably not going to heal. How do surgeons usually deal with that? Well, what surgeons do is they go in and cut those pieces out. Now that's a little bit of a problem, and we'll talk about why, but that's usually what's done today in a meniscectomy or even in what's called a meniscal repair. There's not much repair going on usually. It's usually cutting things out. So what happens in the long run once these pieces are removed? The answer is more arthritis. So basically, as you start taking pieces of meniscus out, there's less meniscus to produce fluid that will preserve the joint, and you tend to get more arthritis, which is a big problem. There are now multiple studies that show this. So is there a better way to fix these tears rather than cutting things out? The answer is yes. We've developed a technique using your stem cells and your growth factors to fix these tears. All this means is that we take stem cells out with a needle, we grow them in culture to much bigger numbers, and then we place your stem cells in the joint through an injection to heal the tear rather than surgically trying to remove pieces. So that, again, what that means for the patient is much less likelihood long term, we believe, of arthritis. Again, that's an adult stem cell injection. You can see here some before and afters from that procedure. You can see the meniscus very ragged there on the left, 3 left pictures on the before column, jagged pieces on the after column. A lot of those pieces have been cleaned up. This is one of several cases that we have where we have evidence on MRI that the stem cells have acted not only to differentiate into meniscus, but also as construction managers, deconstructing things and reconstructing things. So some very interesting pictures here. So arthroscopy versus an adult stem cell injection, you can see here. Arthroscopy, it's the old standard, well researched over the last 20 years, but adult stem cell injections are much less invasive, quicker return to post-op activity, an opportunity to save cells for the future as these cells are used for other things. So if you'd like to find out more about this, go to regenexx.com. That's Regenexx, REGENEXX with 2 X's. Thanks so much for listening.